Have you ever wondered why some people, especially children, seem to be more hyperactive and impulsive than others? This could be more than just high energy or a lively personality. It might be a sign of attention deficit hyperactivity disorder, or ADHD for short. ADHD is a neurodevelopmental disorder that can affect anyone, regardless of age. It's marked by three main traits: inattention, impulsivity, and hyperactivity. Those with ADHD may have trouble focusing, may act without thinking, or may be constantly on the go, often in inappropriate situations. It's important to dispel some common misconceptions about ADHD. It's not a result of laziness, lack of discipline, or poor parenting. It's a genuine medical condition with complex neurological roots. Understanding this can help us approach individuals with ADHD with empathy and support, rather than judgment or frustration. ADHD is a complex disorder, but understanding it can make a world of difference. So, what are the key aspects we need to understand about ADHD? Well, first and foremost, it's important to note that ADHD, or attention deficit/hyperactivity disorder, is not a one-size-fits-all condition. In fact, there are three main types that experts recognize: predominantly inattentive, predominantly hyperactive impulsive, and a combination of the two. The symptoms can vary greatly among individuals and can manifest differently across various environments. Let's break them down a bit. Predominantly inattentive type is often characterized by difficulty in maintaining focus, overlooking details, and struggling with following through on tasks or instructions. Predominantly hyperactive impulsive type, on the other hand, involves behaviors such as fidgeting, an inability to stay seated when required, and a tendency to act without thinking. The combination type, as you may have guessed, includes symptoms from both of the aforementioned types. But there's more to ADHD than just these classifications. It's also crucial to understand that ADHD can coexist with other conditions. This means that a person with ADHD may also have learning disabilities, anxiety disorders, depression, or other co-occurring conditions. This can make diagnosis and treatment a bit more complex, as it's important to address all aspects of an individual's mental health. Now, this might sound overwhelming, but it's important not to lose hope. Yes, ADHD is a lifelong condition, but that doesn't mean it's insurmountable. With the right support and treatment, individuals with ADHD can lead successful and fulfilling lives. This could mean medication, therapy, or a combination of both, depending on the individual's specific needs. What's key here is understanding. Understanding the different aspects of ADHD, understanding the challenges it can bring, and understanding the strategies that can help manage it. This understanding can help reduce the stigma around ADHD and foster a more empathetic, supportive environment for those living with the condition. Remember, ADHD is not a barrier to success. With the right support, individuals with ADHD can thrive. You might be asking, how can I help someone with ADHD? Empathy is your starting point. It's about placing yourself in their shoes, attempting to understand their struggles, their triumphs, their day-to-day experiences. Patience is another key ingredient. Knowing that individuals with ADHD may process things differently, may need more time, or may require a different approach. Educate yourself about ADHD, not just the symptoms, but the underlying causes, the effects on daily life, and the potential gifts it may bring. It's about seeing the whole person, not just the diagnosis. Turn to professionals for help. Therapists, psychiatrists, and support groups can provide invaluable resources and guidance. Treatment options such as behavioral therapy, medication, and lifestyle changes can make a significant difference. Remember, understanding is the first step to acceptance, and only with acceptance can there be recovery. Be part of that journey. Lend your understanding, your patience, and your support.